Okay, good afternoon, everyone. Welcome to the first hearing of the Senate Health Committee for the 2011-2012 session. I'd like to briefly say that I'm particularly excited to have been named chair of this committee, especially with so many exciting things are happening in the healthcare arena, and I'm looking forward to addressing some hard issues. I'm hopeful that throughout the course of this year we will engage in a vigorous but civil debate, and that together we can accomplish some great things for the state of California. I don't see her yet, but I'd like to acknowledge Senator Alquist for all the great work she did chairing this committee in this last year. And I'd also ask Vice Chair Strickland, who I consider a good friend. I don't know why that is, but I'd like to just give him an opportunity to say a few words, but go ahead.
On that note, I too am very excited about the upcoming legislative session. I also do want to acknowledge Senator Alquist's hard work and dedication over the last 2 years, and I'm very much looking forward to working with Senator Hernandez and the chair. We are very good friends, and he does like my wife better than me, but I understand that. But he's a good. I know that we're going to have a great working relationship in this committee. A lot of very important issues to Californians, and I'm looking forward to having a great year. And on that note, I'm very much looking forward to Senator Yee's bill.
I bet you are.
Okay, thank you very much. We don't have a quorum as yet, so we're going to go ahead and get started as a subcommittee. If we do reach a quorum, we'll go ahead and call roll and also deal with the committee rules. But we're going to go out of order at this time. Senator Yee asked that we present SB 105, public safety, snow sport helmets. Senator Yee.
Thank you very much, Mr. Chair and Mr. Vice Chair and Senators. First off, I want to thank you for your consideration for allowing me to present this bill. First, this bill has seen both the Senate side and the Assembly side. It is pretty much a remake of a bill that I authored last year. It got caught up in trying to be of help to a fellow colleague, and so unfortunately we were not able to implement this particular bill, and so that's where we're at now once again. So basically this bill is really about protecting children. The reality is that half of all skiing deaths are caused by a head injury, and then recent studies show that when helmets are used, the incidence of traumatic brain or head injury can be reduced dramatically, and some studies have cited that more than 7,000 head injuries per year on slopes could be prevented or reduced in severity by the use of a helmet. So what this bill will essentially do is to establish a mandatory requirement to wear helmets for skiers and snowboarders under 18 years of age, and this bill mirrors the requirement of having youngsters under 18 to wear a helmet when operating a bike. And so with that, urge and I go.
Amanda Levy with the California Psychological Association. We're the sponsors of this bill, and I wanted to give my time to our chair of our Division of Neuropsychology, Dr. David Lechuga.
Good afternoon. I want to thank you for considering this bill. I spoke in front of this committee last year and thought the response was quite favorable. I just wanted to speak on behalf of my patients and their families. I'm a treating clinical neuropsychologist. I treat amateur and professional athletes who have had brain injuries. And since 1987, I've done this work, and what I've noticed over the years, not just from the research, but from my own clinical practice, is that there are a few areas where we can actually intervene and reduce the incidence of life-changing injuries. One area, very clearly, is the wearing of a helmet. I'm not much in the favor of regulations where regulations are not necessary, but I am in favor of public safety. And I know that if I have two patients, they have the same injury, but one was wearing a helmet and one is not wearing a helmet, the life trajectory is dramatically different, especially if we're dealing with youngsters. So I ask for your support. And I'll just mention a couple of other points here. Recently, I serve as an expert on personal injury lawsuits, and I had a recent case where we had an individual that was not wearing a helmet who sustained a traumatic brain injury. This individual's life care plan totaled $6.5 million. Had he worn this helmet, adolescent, I doubt if that life care plan comes close to 1/100th of that amount. But because he wasn't wearing the helmet, we have to plan for that. Now he's underemployed or unemployable because of the significance of his injury from age 15 forward. So I think it's a good investment. I understand that some of my respected legislator colleagues use terms such as nanny government to describe this type of legislation. Well, I think what we've learned, if you look at these murals, is that at some point in time, government does need to step in. And in a situation where those who can't make good decisions on their own behalf, especially the minors, we do need to step in and do what we can in an educated and tempered manner to protect their lives and the lives of those around them. So, again, I ask for your support as a treating doctor.
Mr. Chairman and members, Mike Dillon representing the California Ski Industry Association. We're all of the major resorts and ski resorts in California. We're pleased to support Senator Yee's measure again. And while I'm not here representing the National Ski Areas Association, we do work closely with them, and you do have a letter on file with their support as well. The National Ski Areas Association does have an aggressive campaign, a helmet safety program called Lids on Kids. And when skiers and boarders go to that website, they see high-profile Olympic athletes urging all kids under 18 years of age to wear helmets. It's a pretty cool sight. According to the NSAA study recently, 86% of the kids under 9 years of age are wearing helmets now, 75% between 10 and 14. The big challenge is the ones between 14 and 18 and 20 and 24. Interestingly enough, 71% of the adults over 65 are wearing helmets. I'm one of those. So the real challenge is to get every young person under 18 to wear helmets, and the goal is 100% by 2012. So we think Senator Yee's measure will help get us there. It's probably going to be a model for other states. And lastly, to get the message to all of our patrons, as the bill says, we have to post signs at the resort, which we're willing to do, put the information on all of our websites, and put the notice in our trail maps that look like these that are in stations all over the mountain. So bottom line, as Dr. Lechuga says, we think this campaign and the requirement will indeed prevent an awful lot of injuries.
Thank you, Mr. Chair, members of the committee. Carolyn Jenna with the California Medical Association. As has been stated by those previously providing testimony, helmets do both drastically improve the health outcomes for children who are injured while skiing and snowboarding, and they also significantly reduce the costs. So helmets save lives, and California physicians support this bill. Thank you, the author.
Mr. Chair, members, Tim Madden representing the California chapter of the American College of Emergency Physicians in support.
Mr. Chair, members, Annie Lamb with the California Chiropractic Association. For the reasons stated, we're here in strong support.
Anyone else in support of the measure? Anyone in opposition to the measure? We don't have a quorum yet. Question, Senator?
Senator Yee, as I look through the bill, I see that you have a fine structure, but there's no entity that collects that fine. What's your vision in terms of, as the fines go and the revenues? I don't see an entity in the bill that it goes back to locals or the resorts. I mean, what's your vision as this bill moves forward on the fine process?
The honest answer on that one is that we were not so much focused on where the dollars would go, but rather to use this, I think, as the industry representative indicate, that we want to use this bill and what it tries to do as part and parcel of an overall program, comprehensive program of just getting kids to wear their helmet. And so the fine, we hope that would be a deterrent from not wearing any helmets whatsoever. So, but with the bill as it stands, what happens is that it just simply goes back into a LOGOS general fund. With that said, however, that there are current allocation structures for how those dollars are in fact dispersed, and it goes part of the money goes to a peace officer training program, driver training, and then a traumatic brain injury fund. So the dollars are distributed accordingly based on current code to some of these entities.
Second question is, who's directly responsible for the enforcement? Is it the ski resorts, or is it the...
No,
who's directly responsible?
Like any of these kinds of infractions, it's law enforcement personnel who are responsible for doing it. But again, this is not about so much that we're going to hang a neon sign that says that these individuals are going to come by and hit you with a fine. But rather, this is really an additional sort of tool that individuals, adults will have, particularly parents will have, to just remind their kids that you ought to be wearing a helmet. But to answer your question directly, it would be in fact law enforcement personnel.
So your vision is a 16, 17-year-old will be riding down the slopes without the helmet, and law enforcement is going to be the ones that tag?
Well, I think that based on this particular bill, it would in fact be a law enforcement individual who would be doing it. What is the likelihood of a law enforcement individual responding to that specifically? Probably not. But again, this is more about trying to provide one additional tool in that toolbox of a comprehensive program of trying to get kids to really wear a helmet.
All right, thank you.
Further testimony in support or opposition?
In support, Mr. Chairman. Brian Lundgren on behalf of the California Ski, Snowboard, and Safety Organization in support.
Anyone else in support? Anyone else or anyone in opposition? Senator, I believe obviously that traumatic brain injury is a very serious, condition that can occur, especially in skiing or any kind of accidents. And I also believe that wearing a helmet is something very, very important. And I can sense kind of where you're going from how this first debate occurred with bicycles and how we got to that point. I'm going to be supportive of the measure. I do have some concerns and some questions as were raised by Senator Strickland as well. I don't think it goes quite far enough with regard to the implementation or the policing of it. If you leave it just to strictly law enforcement, it's going to be tough for them to kind of just go up in the slopes and assess these various fines. But I will be supporting it. I think it's going in the right direction, but keep that in mind. Unfortunately, we do not have a quorum at this time, so when we do, we will bring the bill up, but I will recommend it do pass to appropriations.
Thank you very much, Mr. Chair. And I just want to add that we really have worked hard to find a balance in this. The California Psychological Association and the industry have been in rather long discussion about finding that particular balance. I think we found that balance, and as you see, there's no opposition. I think there's a willingness for both parties to really try to work out a compromise, and I think we have achieved that. I think that you're absolutely correct, some of the concerns that you have raised. All I would say is that let's just see how this thing works, and more happy to come back and refine it and increase it if, in fact, it turns out that what is talked about within this particular bill is not working. Thank you.
Okay, thank you, Senator Lee.
Thank you.
Okay, good afternoon, Senator. You're going to be presenting SB 336, emergency room crowding. Is that correct?
No, it's SB 21.
SB 21. I'm sorry. I apologize. And I understand you have some authors' amendments?
Yes, we do, and I think the sergeant is passing them out.
Okay. Yes, I got a copy. Go ahead.
Thank you, Mr. Chair, members. Senator Ahlquist and I bring this bill to you today, and we appreciate the collaborative efforts of many individuals, organizations, and stakeholders. This is a reintroduction of last year's SB 998, and it reflects 2 public hearings and many meetings and conference calls. And as I said, the sergeant is passing out those amendments that reflect the suggestions of the California Association of Health Facilities. And as amended, SB 21 will bring about 3 important reforms in long-term care. First, it provides case management and transition services to individuals who enter a skilled nursing facility and need assistance to get back home, or those who are at imminent risk of being placed in a skilled nursing facility and can remain at home with some assistance. Second, it creates a process to improve our assessment of what services these individuals need. And third, it leads to a better data set about those Californians who are in need of long-term care, so our planning and budget decisions will improve. Persons in long-term care in California often want to stay in their own homes or return home as soon as possible after surgery or an incident such as a broken hip. There are many services available to help them. However, for the most part, the aged, the disabled individual must navigate this set of services alone. Each service may require its own assessment, have its own offices, or depend on the individual to know about the service and make it work. This bill takes a major step toward establishing an integrated system of long-term care with case management for some individuals. It establishes case management and transition services county by county, starting with providing those services to persons who have been in skilled nursing homes for 21 days or more. We believe that providing these services to individuals, we will improve our compliance with federal and state laws, including the Olmstead decision, add to the quality of life of elderly and the disabled Californians, and save money. This approach works in Washington, Oregon, Pennsylvania, and Texas, who provide a small amount of social services and help with home modifications to get people home, which is where they want to be at great savings to the state. Then the beds of skilled nursing facilities can be used for those for whom this is the best placement, not a placement of last resort. And our witnesses today include Gary Passmore from the Congress of California Seniors and Jordan Lindsay from the California Association for Health Services at Home and others.
Mr. Chair, members of the committee, first welcome. Senator Hernandez, you follow a distinguished group of former chairs, and we are confident that you are going to be among them. So welcome.
Thank you very much.
We are proud to support SB 21 and thank Senator Lieu and Senator Ahlquist for focusing on this issue. Today in California, and actually across the nation, long-term care is undergoing some profound changes, some of which are being driven by our fiscal situation, but others because of the recognition that the system, as we call it, of long-term care has never really been a system. It's been kind of a fractured and disorganized network of individual services, and it's been, as the Senator said, it's been very difficult for seniors and people with disabilities who rely on the programs to navigate this system. We have, those of us who advocate for seniors and persons with disabilities and others have recognized for a very long time we needed to organize this array of services that we call a system of long-term care. And I think it's important to remind the committee that long-term care isn't something many of us think about and almost none of us plan for. Research sponsored by the SCAN Foundation last year showed that 70% of the people in California will need long-term care, and more than that number have absolutely no plans whatsoever for how to provide it. Long-term care is literally being organized as a stroke patient comes out of the hospital. As the Senator said, the family of an aged person that's had a broken hip tries to figure out how that person's going to cope and whether they can can go home. And we need to focus on the key point of discharge from a hospital, because that's how many people end up in long-term care, or the point at which they do, and focus on assessment, the creation of a plan of care, and then management of the services that are in support of it. So this is a first step. It's a work in progress, frankly, but we are strongly supportive of this effort. Thanks.
Thank you. Next individual in support.
Thank you, Mr. Chair and members. Jordan Lindsay with the California Association for Health Services at Home, representing home health agencies, home care agencies, hospice, and other array of services for individuals in their home. As California continues to further comply with the Olmstead decision to ensure that seniors, people with disabilities, and other frail Californians can receive care in the least restrictive setting, we believe that it's critically important that we have a more coordinated, more seamless long-term care continuum, and we believe that SB 21 is a major step in the right direction towards that seamless long-term care continuum, as my colleague Gary mentioned, for many of the same reasons. We strongly urge your support of SB 21. As well, there's a couple options out there, we believe, for some funding alternatives, including perhaps maybe current medical home, health home options for the federal government, which would throw in a 90% match, which we think for some case management, it may be able to apply for this type of case management as well. Thank you.
Thank you. Next presenter.
Thank you, Mr. Chair and committee members. My name is Patricia Blaisdell, and I'm here on behalf of the California Hospital Association. Our membership includes over 120 hospital-based skilled nursing facilities, as well as numerous other acute and post-acute care service providers, with the shared goal of helping our patients transition back to home and community. We're here in support of SB 21. We applaud its goal of establishing effective and accessible community-based care management services for the elders and persons with disability that are under our care, and those that are at risk of long-term institutionalization. We've appreciated the opportunity to work with the staff on this bill, and we support the worthy goals of this bill.
You turned me off. Thank you, Mr. Chair and members. Kathy Sunderling with the County Welfare Directors Association, also in support of the bill. We've been included in the discussions that led up to last year's legislation and continue to support this bill's approach to long-term care integration and coordination. Thanks.
Mr. Chair, members, Robert Harris on behalf of the 280,000 members of the Service Employees International Union who work in long-term care. We don't have a formal position on the bill yet, but the bill is so timely, in fact, is it so long overdue that in 1982, then Assembly Health Chair, Vice Chair Jerry Philando introduced a bill to do the same kinds of thing because of the problems in the long-term care quote system that in fact is not a system. That Senator Liu's been diligent at working on this. It's a critical issue. We think it's so important that in fact some of the ideas in this bill were contained in budget solutions that we proposed this year. They weren't included in the final budget, but if there is no final budget, they might end up included in the final budget, as a matter of fact. We look forward to working with the member. We think there are things to work out. We're concerned about the fact that realignment 2 says you move IHSS up to the statewide level, and so we think there'd be some changes due to that, but we want plan and hope and want to continue in the conversation to try and come to a place where we actually have a system of care for long-term needs in California. Thank you so much.
Mr. Chair, members, Casey Young with AARP, as many others have said, we understand this is a work in progress, but it's a very important effort. We support this effort. The one concern we had was the extent of the public participation provisions. I understand it was amended, and I trust we will like those amendments. Thank you. I urge you to pass the bill.
Thank you. Anyone else like to speak in support of the bill? Please state your name and...
Alex Graves on behalf of the Alzheimer's Association. We're also in strong support for all the reasons stated. Thank you.
Is there anyone in opposition to the bill?
Not in opposition.
Pardon me?
Still support.
Still support. Please come on up. State your name.
Yeah, my name is C.T. Weber. I'm here on behalf of the California Alliance for Retired Americans. This is one of our priority bills this year, and we're in full support.
Dennis Hubbard, also from PARA, and we're in full support for the various reasons given. We have a grassroots organization, 900,000 people strong, and their families, and we believe that this will give a good support to people who are not only in the care homes, but also for discharge planning.
Excuse me, I'm going to interrupt for just a second. We have a quorum. Call the roll, please.
Senator Hernandez?
Here.
Hernandez here. Strickland?
Here.
Strickland here. Alquist? Anderson? Blakesley? De Leon? De Leon here. DeSaulnier? DeSaulnier here. Rubio? Wolk? Wolk here.
We have a quorum established. We're going to go ahead first order of business, if you don't mind. While I have a quorum, we're going to approve the committee rules. I move to adopt so moved. Call the roll, please.
Senator Hernandez?
Aye.
Hernandez, aye. Strickland? Strickland, aye. Alquist? Anderson? Blakesley? De Leon? De Leon, aye. DeSaulnier?
Aye.
DeSaulnier, aye. Rubio? Wolk? Wolk, aye. And that is
5-0, and the committee rules have been adopted. Sorry to interrupt. It's very seldom we get a quorum, and when we do, we have to take advantage of it. So please proceed.
Hi, my name's Greg Thompson. I'm the Executive Director of the Personal Assistance Service Council of Los Angeles, and I'm also representing the California Association of Public Authorities, and we are in support of this bill. I think since the Olmstead Act, there's been a significant lack of coordination, and I think this bill really attempts to bring the coordination of care to individuals and more importantly should create a lot of opportunities for people to become independent in the community. And I know in Los Angeles County, we are looking at a lot of different models to try to make that happen. And so both myself, representing Los Angeles, or the California Association of Public Authorities would love to be involved in any stakeholder process. And I think the other significant issue about this bill is that when people are not institutionalized and they're able to live in the community, it also further lends their ability to return to school and return to work. So we encourage you to vote yes on this bill. Thank you.
Thank you. Is there anyone else who would like to speak on support of the measure? Anyone in opposition? We have a motion to, and please close.
Well, I simply ask for your approval of this bill, and thank you for your consideration.
Thank you. I will recommend do pass as amended to appropriations. Call the roll, please.
Senator Hernandez. Senator Hernandez?
Aye.
Hernandez, aye. Strickland?
No.
Strickland, no. Alquist? Anderson? Blakesley? De Leon? DeSaulnier?
Aye.
DeSaulnier, aye. Rubio? Wolk? Aye. Wolk, aye.
We have 3-1. You need 2 more. We'll put it on call.
Thank you.
Thank you. We're going to do the consent calendar, if you don't mind, Senator Smidian first. We have a proposed consent calendar. So moved. I believe we're going to have to take it off consent to add the amendments. That's exactly what you meant. Okay. We'll take it off consent at this time. We'll add the amendments. And
Senator Hernandez?
aye.
Hernandez, aye. Strickland?
Aye.
Strickland, aye. Alquist? Anderson? Blakesley? De Leon? DeSaulnier?
Aye.
DeSaulnier, aye. Rubio? Wolk? Wolk, aye.
So we can't take the amendments, all right? Okay. We don't have the appropriate number of votes to put the amendments on. We'll have to come back to this consent item at a later time. Senator Smidian, you ready?
Thank you, Mr. Chairman and members.
If you take a look at the very brief summary on the first page of your committee analysis, it does, I think, a nice job of summarizing what we're trying to do here in just a couple of sentences. Should begin by saying happy to take the suggested clarifying amendments that are on, I believe, page 6 of the analysis. And I want to make a particular pitch this year, Mr. Chairman, for Republican support on the bill, and hope that I can persuade my colleagues on both sides of the aisle the bill is worthy. Here's what the bill does. It allows, so I want to underscore that, it doesn't require anybody to do anything. It allows local counties to access federal funds that are already allocated and will be spent, but will not be accessible here in California if we don't change the law. It allows local counties to access those federal funds if they choose to use their own local funds for county health initiative matching fund programs. That's what the bill does. The specific issue that we're trying to address is the problem with high-cost counties. In many parts of the state, when you say 300% of poverty, that ought to be a reasonable cap in terms of who we're going to provide help to. That will be a reasonable limit, I suspect, given the cost of living. But as we know, cost of living is disparate throughout the state. In high-cost counties, some of the counties have made the judgment they'd like to use some local funds to help provide these programs of insurance. They are currently leaving federal dollars on the table that are going to other states. This measure simply says, let's increase the allowable level from 300% of federal poverty to 400% of federal poverty. That will allow local communities to make their own judgments about using their own funds and won't leave federal money on the table. I want to underscore, no cost to the state, no cost to the state. There are some administrative costs which are fully reimbursed by the locals, and if anything, this measure reduces cost pressure on the state because local folks are putting local and federal money up, which relieves the state of any cost pressure to provide the same services using state funds. No opposition on the bill. No opposition on the bill. List of 20 supporters here today. We do have some witnesses in support.
Thank you. Please state your name and your
Chairman
position.
Hernandez, Vice Chairman Strickland, honorable members, I'm Srija Srinivasan from San Mateo County's health system, and I thank you for your consideration of this bill. This is a really tough time for families in California, and this bill follows the history of this body in making health insurance coverage available to children. In San Mateo County, we've been proud to reduce the number of uninsured children through the assistance of the state and the federal government to leverage our local dollars to the maximum extent possible. And between now and 2014, this is the one-year anniversary of the federal health reform law, there continue to be children who need our support to have access to health insurance coverage. This bill would help about 350 children in San Mateo County and leverage between $150,000 and $200,000 in federal funding. We hope that that money can come to Californians rather than residents of other states. And we believe that in these times, partnership between the locals, the state, and the federal government is more important than ever. And our elected officials are willing to do their share to make that a reality for children. So we thank you for your consideration.
Thank you. And the next presenter.
Juliana Vorse with the Urban Counties Caucus in support of the bill. As Senator Simonian said, this would allow the flexibility for counties, if they wish to use their own money to get more federal match. And at this time, we need all the help we can get at the county level. So we urge your support. Thank you.
Thank you.
Christy Weiss on behalf of the Local Health Plans of California. These are the local initiatives in the two plan counties. We're in support of the bill, and we think this is a very common sense measure to capture a number of kids who otherwise would fall through the cracks. Thank you.
Nicole Wortleman on behalf of the City and County of San Francisco, as well as the Alameda County Board of Supervisors, also in support.
Carolyn Jenna with the California Medical Association. California's physicians absolutely support creative means to make sure that everyone has coverage and support these local counties' efforts to do so, and the senators authoring the bill. Thank you.
Farrah McDade Ting, representing the California State Association of Counties, in support.
Kathy Sunderling with the County Welfare Directors Association, in support.
Michael Radigan on behalf of the Board of Supervisors of Santa Clara County, here in strong support.
Monica Miller on behalf of the California Chiropractic Association, in support. Thank you.
Dolores Duran Flores with the California School Employees Association in support.
Tim Madden with the California chapter of the American College of Emergency Physicians in support.
Thank you. Is anyone else in support of the measure? Is there any opposition to the measure? Is there a motion? So moved. Please close.
Respectfully ask for an aye vote.
Thank you. Senator, call the roll.
Senator Hernandez?
Aye.
Hernandez, aye. Strickland?
No.
Strickland, no. Alquist? Anderson? Blakesley? De Leon? DeSaulnier?
Aye.
DeSaulnier, aye. Rubio? Wolk? Wolk, aye.
Measure is 3-1. We'll put it on the call, Senator.
Thank you, Mr. Chairman. Thank you, members.
And we're going to go back to SB 105. Is there someone who's willing to move the bill? So moved. Call the roll.
Senator Hernandez?
Aye.
Hernandez, aye. Strickland?
Aye.
Strickland, aye. Alquist? Anderson? Blakesley? De Leon? DeSaulnier?
Aye.
DeSaulnier, aye. Rubio? Wolk? Aye. Wolk, aye.
That's 4-0. We'll place that one on call and lift a call at a later time. And we have, looks like we have Senator Padilla.
Good afternoon, Mr. Chair. I have two bills before you today. Let me begin with SB 38. And let me start my remarks by accepting as author's amendments those suggested in the analysis relative to a duplicative reporting requirement. This bill is a technical cleanup bill to last year's SB 1237, which was signed into law by Governor Schwarzenegger. And specifically, the purpose of this bill is to clarify the date of effectiveness for the reporting requirements for hospitals and other imaging facilities when it comes to the misadministration, over-radiation, if you will, of patients. Last year's bill I introduced because of the not only the number of increase in CT scans and other imaging procedures that are really exponentially increasing in use, but the stories specifically of people being over-radiated, not just in Southern California, but throughout the state and throughout the country. So it was a consumer protection bill, if you will, that was supported on a bipartisan basis, signed into law. There was just the way it was intended and the way it was codified had not clear the date of effectiveness, so that's what this bill would clarify. This requirement goes into effect July 1st, 2012. With me in support of this needed technical cleanup are Catherine Scott on behalf of the Hospital Association and Bob Ackerman representing the Radiological Society.
Afternoon.
Good
Catherine
afternoon.
Scott with the Hospital Association. We worked diligently last year on 1237 to work through what is a highly technical opportunity or a highly technical bill that would allow for reporting in over-radiation of environments where a patient was over-radiated through a CT exam. But we recognized through that process that the room of physicists needed to come to further agreement around, for example, what is an effective dose and so forth. So last year had agreed that we would provide some time this year to develop that type of regulation and or interpretation. But unfortunately, as the Senator said, through a technical error, CDPH is now left to regulate this bill now, which puts our hospitals and CDPH in a difficult position of trying to interpret what is an effective dose, for example, without the guidance of physicists or regulations. So for the hospital level, it's important that we move this implementation date forward, allowing that important work to be done over the next few months and that regulation developed so that we're all clearly aware of what the law is and when reporting requirements are required to be done.
Thank you. And
Mr. Chair and members, Bob Ackerman on behalf of the California Radiological Society shared the comments of Ms. Scott. It was the intent that we allow that time, and it was a drafting error towards the end where all the sections ended up with effective dates except for this one. So I think the Senator's intent was to do just this. So as she said, effective dose is what's important here in terms of individual application to a patient. That requires a great deal of physicist calculation so that we're all on the same page in terms of what dose is being reported. So we support the bill.
Paul Miner, General Electric Company. I'd like to take an opportunity to thank the Senator and staff for working, bringing everybody together and working so diligently to get these technical cleanups to you all so quickly, and we're in support of the bill.
Thank you very much, Mr. Chairman. Stan Van Vleck, representing Siemens, one of the world's major manufacturers of this type of equipment. We, too, appreciate the Senator and staff for working with us, and we look forward to continuing to work with them over the years on getting this as good as possible. Thank you.
Good afternoon. Chris Rosa, representing the AdvaMed, which is the Advanced Medical Technology Association. They're the National Trade Association for Medical Device Manufacturers, and we're in support.
Okay, anyone else in support of the measure? Is anyone in opposition to the measure? We have a motion to move the bill. Please close. Senator Padilla.
I'm just happy to present a bill that even Senator Strickland can support. Would ask for your aye vote.
Okay, Senator, I'm going to recommend a do pass as amended. Call the roll, please.
Senator Hernandez?
Here. Aye.
Hernandez, aye. Strickland? Aye. Strickland, aye. Alquist? Anderson? Anderson, no. Blakesley? De Leon? DeSaulnier? DeSaulnier, aye. Rubio? Wolk? Wolk, aye.
It's 4-1. We'll put the measure on call. While you're up, you don't have to present, but item number 5, SB 303, is a consent calendar. I think we can probably lift the call and re-vote on that one to put the amendments on, and then we're going to do the consent calendar. So call the absent members.
Senator Alquist? Anderson? Aye. Anderson, aye. Blakesley? De Leon? Rubio?
It's 5.
So 1, 2, 3, 4. Got 4.
Oh, I thought we had 5.
5, sorry. Strickland.
Strickland. Okay, so we have 5. So the amendments have been taken. We're going to place that now on consent. So move the bill. Call the roll for the consent itself.
Senator Hernandez?
Aye.
Hernandez, aye. Strickland?
Aye.
Strickland, aye. Alquist? Anderson? Aye. Anderson, aye. Blakesley? De Leon? DeSaulnier? DeSaulnier, aye. Rubio? Wolk? Wolk, aye.
Okay, that's 5. Your bill is out. Thank you, Senator. I'm going to turn the gavel over to my vice chair. I'm going to go ahead and present my bill.
Members, we're doing file item number 7, SB 635, by the chairman. Chairman, would you like to open?
Yes, thank you, Senator Strickland, Mr. Chair, and members and committee members. This bill is an effort to address the shortage of healthcare workers in California. It will direct funds currently going to the Mr. MIP program, to the Song Brown program administered by the Office of Statewide Health Planning and Development. That's OSHPD. Mr. MIP is the state's high-risk pool for the uninsured, but will be phased out in 2014 once the Federal Affordable Care Act is fully implemented. The funds come from fines and penalties levied on health plans, which were generally HMOs, and the Song Brown Health Workforce Force Training Act, or better known as Song Brown Program, was established in 1973 to increase the number of health professionals training slots in established medical schools, and the program encourages universities and primary care health professionals to provide health care in medically underserved areas. And it provides financial support to family practice residency, nurse practitioner, physician assistant, and registered nurse education programs throughout California. I am pleased to say that I have support from the California Hospital Association, the California Association of Nurse Practitioners, the California Academy of Physician Assistants, and the California Academy of Family Physicians. I have with me today individuals that would like to testify on behalf of the measure, and I respectfully ask for an aye vote.
Witnesses in support?
Good afternoon. Thank you, Chair and committee members. I'm Gail Blanchard-Sager. I'm with the California Hospital Association, and we are pleased to support SB 635 as well as the Chair's efforts on workforce development over the years. This bill would provide much-needed funding for healthcare workforce development programs without imposing any additional costs on stakeholders, including the state, our educational institutions, or healthcare providers. While there have been conflicting reports in the media about current demand for nursing and allied health workers, a recent California Hospital Association survey provides strong evidence that these workers will be in high demand in California hospitals over the next 5 years. Add to this the workforce demands in other providing organizations such as long-term care facilities, community and behavioral health clinics. It's clear that California is not currently poised to provide all the healthcare workers that are going to be needed. Healthcare will continue to be an engine of economic growth in the coming years as California's population increases. A recent survey by the California Hospital Association shows that there will be a projected 63% increase between 2010 and 2030, particularly in the allied health fields. There are over 200 allied health professions, including clinical lab scientists, imaging technologists, physical therapists, respiratory therapists, and others. Between new job creation and the need to replace workers who retire or otherwise leave the field, the state will need to train nearly 1 million allied health workers by 2013. As such, we strongly support including other health workforce programs administered by OSHPD, such as the Allied Health Scholarship Program. In conclusion, CHA is pleased to offer support for SB 635, which will not only provide incentives for health professionals to serve in medically underserved areas, but will also provide targeted sources of support to California's public institutions of higher education, including community colleges, California state universities, and UCs, as they struggle to meet the impending demand for doctors, nurses, and a vast array of allied health professionals. Thank you.
Other witnesses in support?
Christy Weiss on behalf of the California Association for Nurse Practitioners in support of the bill. We're 1 year closer to implementation of federal health care reform, and I think we all recognize that with the many people who will become insured and who will be coming into the healthcare system, we will need even more providers to help provide care to those people, and we think this bill takes great steps towards helping ensure that that workforce is there.
Thank you, Mr. Chairman, members of the committee. Maureen O'Haron, representing City of Hope National Medical Center. City of Hope is a cancer research and treatment center in Southern California, and because of the highly intense services that we provide, particularly in our bone marrow transplantation program, we have a high demand for nurses. We have a high nurse-to-patient staffing ratio. At any one time, we have openings for 40 nurses at our campus, and so this bill is critical. We really need more resources going toward workforce training. Thank you.
Thank you. Other witnesses?
Mr. Chairman, Tom Riley with the California Academy of Family Physicians and Osteopathic Physicians and Surgeons of California. This is not only a great program with a great track record, but this transition of money into it comes at a really important time. It's not just about the family physicians that train in medically underserved areas through this program. It's about all the others that train in the program. And it's training them to work as a team at a time when it's really important to work as a team to make sure that the limited resources of primary care in the state really go as far as they possibly can, and we urge your support.
Dean Garfield with the California Medical Association. We have a supportive amended. Wanted to thank the author and continuing to be a champion on this issue of improving healthcare workforce here in California. I've been in contact with his staff about determining what are other potential ways in which these monies can be best utilized for the state. Thank you, Senator.
Thank you. Witnesses' opposition? Would you like to close, Mr.?
Yes, thank you, Senator Strickland. As we all know, 2014 is just right around the corner with the implementation of the federal health care bill. As we all know, that just the fact that you have a health insurance card doesn't mean that individuals are going to have access to health care. And this is just a small part of what it's going to take to make sure that we get more primary care providers and or nurses into these most underserved areas. And these are the areas that have the highest incidence of chronic diseases and the highest incidence of need. So I respectfully ask for your aye vote.
Senator Anderson moves the bill. Secretary, please call the roll.
Senator Hernandez?
Here, aye.
Hernandez, aye. Strickland? Strickland, aye. Alquist? Anderson? Anderson, aye. Blakesley? De Leon? DeSaulnier?
Aye.
DeSaulnier, aye. Rubio? Aye. Rubio, aye. Wolk? Wolk, aye.
That bill has 6 votes, so it will remain on call for absent members.
I just want to state that Senator Rubio said he came back specifically to vote on this bill, right? Senator Liu, welcome. We're waiting for you on file item number 6, SB 336, emergency room crowding. And you can take the podium up here if you like. Welcome.
Hi. Thank you, Mr. Chair and Senators. This bill is an important measure that seeks to address ER overcrowding, and it helps save lives. This bill would improve ER care by requiring all California hospitals to create and implement a full capacity protocol plan. This plan requires hospitals to assess the results of a crowding scale every 4 hours and then provide solutions at each stage of overcrowding scale. You know, emergency rooms are the great equalizer. It doesn't really matter if you are a CEO in Malibu or you're a homeless person on the street. If you are in need of ER care and then you have to be diverted because your hospital is overcrowded, your chance of death just increased. And so this bill is a step towards mitigating that. And I have with me here witnesses in support of the bill.
Good afternoon. Thank you.
Mr. Chair and members, Tim Madden, representing the California chapter of the American College of Emergency Physicians. We are the sponsor of SB 336. What this bill looks to address is a portion of overcrowding that's referred to as boarding. And this represents the time from when a patient comes into the emergency department and they're stabilized, but they still need to receive some additional care and be admitted into the hospital. So it's the amount of time that they're waiting in the emergency department to find a bed upstairs in the hospitals. We're finding that patient boarding times continue to be a problem at California's emergency departments. Just last week, I had a Senate staffer chase me down the hallways and tell me about their experience at a local Sacramento hospital where they went in and they were placed into the hallway of the emergency department. Next to them was a prisoner who was handcuffed to the gurney, screaming that he wanted to kill himself. We need to find ways to help emergency departments get patients upstairs to receive a higher level of care. Studies have shown the longer the patient remains in the emergency department, the longer their stay is in the hospital. These are additional healthcare costs to the system that can be avoided. CalASA believes SB 336 represents an opportunity to reduce boarding times. This simple approach that has hospitals working more efficiently during the times when the emergency department is the most crowded has shown to be very effective, as seen at LA County USC Medical Center, which implements the process included in SB 336. As we all know, with the difficult budget cuts that were made last week to health, which all have the trickle-down effect of leading patients into the emergency department, now more than ever, we need to look at the best practices used by providers like LA County USC Medical Center to address what will only be an escalating problem with our overcrowded emergency departments. For these reasons, we respectfully ask for your aye vote.
Thank you, and please state your name and your position.
Thank you, Mr. Chair, members of the committee. Carolyn Jenna with the California Medical Association would concur with the testimony made by Mr. Madden. And just also to the Senator's point about we all need emergency rooms. We all need to make sure that that access is there. And given the budget cuts made last week, we're going to be driving more and more traffic into them. It's even more critical now than ever to have a full picture of what's going on there and how we can facilitate everyone's access, because everyone will need it. Thank you.
Thank you. Is there anyone else that'd like to speak in support of the measure? Is there anyone that'd like to speak in opposition? Welcome. Please state your name and your position.
On behalf of the Tim Lynch on behalf of the San Bernardino County Board of Supervisors, representing the county hospital in our county, Arrowhead Regional Medical Center, which is one of the busiest and covers the largest geographic area. We want to thank the author and the sponsors. Quite frankly, they have gone above and beyond the call of duty to reach out to us, include us. Unfortunately, I think we've just reached a point where we have a philosophical disagreement about whether or not these tools should be implemented on a statewide basis or locally. I'm told by our hospital management that they do a terrific job locally. They've got the local tools to do it, and nobody wants to see their ERs overcrowded. So we just have a disagreement at this point about the best way to proceed.
Thank you. Is there anyone else who'd like to speak in opposition to the measure?
Move the bill.
We have a motion to move the bill. Senator Liu, I want to thank you for bringing this forward. I have had the opportunity of actually visiting one of my local emergency rooms. Mr. Madden also was there, and this is quite a problem, especially in my area with regards to boarding. So I'm going to recommend due pass to appropriations. Call the roll.
Senator Hernandez?
Aye.
Hernandez, aye. Strickland? Strickland, aye. Alquist? Anderson? Blakesley? De Leon? DeSaulnier? DeSaulnier, aye. Rubio?
Aye.
Rubio, aye. Wolk? Wolk, aye.
It's 5-0. The measure is out. I will still leave the roll open if anyone would like to add on at a later time. Thank you, Senator. Senator Anderson did vote aye in the last call, last vote. Okay, let's go ahead and get back and finish up the business. We're going to go ahead and lift the calls for all of the remaining bills. We're going to first start off with item number 1, SB 21, Lou Long-Term Care Assessment and Planning. Call the absent members. And the original vote is 3-1.
Senator Alquist. Aye. Alquist, aye. Anderson.
I'm sorry. What? On this one? Yeah.
No.
Anderson, no. Blakesley.
Aye.
Blakesley, aye. De Leon.
Aye.
De Leon, aye. Rubio.
Aye.
Rubio, aye.
6-3.
The vote is 6-3. The measure is passed. The next item is item number 2, SB 36, Median County Health Initiative Matching Fund. The current vote is 3-1. Call the absent members.
Senator Alquist. Aye. Alquist, aye. Anderson.
No.
Anderson, no. Blakesley.
Not voting.
De Leon.
Aye.
De Leon, aye. Rubio.
Double aye.
Rubio, aye.
The vote is 6-2. The measure passes. The next item, we're going to lift a call for item number 3, SB 38, Padilla Radiation Control Health Facilities. The current vote is 4-1. Call the absent members.
Senator Alquist. Aye. Alquist, aye. Blakesley.
Aye.
Blakesley, aye. De Leon.
Aye.
De Leon, aye. Rubio.
Aye.
Rubio, aye.
8-1.
The vote is 8-1. The measure is out. The next item is item number 4, SB 105, Yee Public Safety Snow Sport Helmets. The current vote is 4-0. 4-0. Call the absent members.
Senator Alquist. Aye. Alquist, aye. Anderson.
No.
Anderson, no. Blakesley.
Aye.
Blakesley, aye. De Leon.
Aye.
De Leon, aye. Rubio.
Aye.
Rubio, aye.
And that is 8-1.
The vote count is 8-1. The measure is out. Item number 5 is the consent calendar. We already voted on it. Item number 6, SB 336, Lou Emergency Room Crowding.
6-0.
That's 6-0, but we'll go ahead and lift a call for the absent members who want to.
Senator Alquist. Alquist, aye. Blakesley.
Aye.
Blakesley, aye. De Leon.
Item number 6.
De Leon, aye.
Aye.
That's 9-0.
You're the joint author. It was 9-0. The measure is out. The last and final item for today is item number 7, SB 635, Hernandez Healthcare Workforce. It's currently 6-0, but we're going to lift the call for the absent members. Call the roll.
Senator Alquist. Alquist, aye. Blakesley.
Aye.
Blakesley, aye. De Leon. De Leon, aye.
And that is 9-0. The measure is out. I'd like to thank everybody, but more in particular, I'd like to thank the Senate Health. This is the first committee hearing that I've ran in the State Senate. You guys did a wonderful job. Thank all of you. And we'll call the meeting. We'll adjourn.